Okay, we're here with Edwin today at Dr. Daniel Perro's office. Edwin, tell us, how'd you find Dr. Perro?
Just through the internet. I was Googling for a podiatrist to help me out with my shin splints.
Okay, great. So is that what you came to see Dr. Perro for, was shin splints?
Yes, shin
Okay.
splints, yeah.
And tell us about your first encounter with Dr. Perro. How'd that go?
It was very good. Dr. Perro was very professional. Staff were very welcoming. So, yeah, It was a good experience.
And as far as the shin splints went, when you saw Dr. Perro, what did he say about the shin splints? What did he recommend?
It seemed like he recommended like a pretty conservative treatment at first, the orthotics, but the orthotics didn't work out for me. So then I opted to try HyProCure.
Got it. So when you came in, he tried to treat you conservatively with orthotics. Were the orthotics over-the-counter orthotics? Did you get the custom-made orthotics?
The custom-made.
The custom-made orthotics, and once you learned that the custom-made orthotics did not work, then Dr. Perro mentioned the HyProCure surgery?
Yes.
Okay, and were you able to do some research on that HyProCure surgery before you decided to go forward with it?
Oh yeah, a lot of research.
Okay, and then when you saw Dr. Perro and you guys decided that you were going to go forward with the HyProCure surgery, from that time to the surgery time, how long of a process was that, and how simple or how difficult of a process was that for you?
It was pretty simple. The forms were sent over to my physician, and we got all that stuff done. And then we were, next thing I know, setting up a date for the surgery.
So you would say from the time that Dr. Perro mentioned the HyProCure surgery and you decided to go with it, would you say it was about a week, a month, 6 months, a year before you got the surgery?
I'd say about a month, just because of booking and the pandemic and all that.
And then was the surgery done in the office, at a hospital, at the surgery center?
At the office.
At the office? And how did you feel that went at the office? Was it pretty smooth as far as getting in, getting out, being comfortable?
Yeah, it was very smooth, yeah.
No problems, no issues?
No, it was way better than whatever I was expecting. This was my first time doing something like that in an office setting, and it was good.
Awesome. And then post-operatively, so you already had both feet done?
Yes.
Okay, good. And the surgeries for the left foot and for the right foot, did they both go as expected?
Yeah. Very little, though. I mean, there was no pain during the surgery, and yeah, it was better than expected.
And as far as the surgery went, was it a long process? How long were you in there during the surgery?
Oh, it's pretty short. Much shorter than anything I expected, so yeah.
Gotcha. And then after the surgery, did you walk out of the room? Were you carried out of the room? How did you...
I think I walked out for the first surgery, and then I just used my little knee cart for the second surgery, but I could have walked out. I'm just extra cautious all the time.
Gotcha. So would you say after the surgery, which you say took approximately 10 to 15 minutes, you're actually able to stand up and walk out of the room?
Yeah. I didn't feel anything. Yeah.
That's awesome. And then, as you said, post-operatively, you had no pain whatsoever. Were you taking any kind of medications to mask the pain, or there was just not a lot of pain at all?
I took the Percocet for the first surgery, and then I didn't use ibuprofen. Then the second time around, I didn't take any Percocet. I just took the ibuprofen that was prescribed, and it was good. Yeah.
That's great. Overall, how would you say that you are? How was your experience with the office, with the surgery, with Dr. Perro?
Very professional. I at no point in time was worried about whether Dr. Perro would do a good job or anything like that. He seemed very confident, and was very welcoming to the office. So yeah.
That's great. And then, would you recommend Dr. Perro or this surgery to your friends and your family?
Oh yeah. If I felt like they should talk to Dr. Perro about it, I definitely would recommend it.
Awesome. Thank you very much. We appreciate it.
No problem.